Respected physical education teacher and dear students, myself Praveen Kumar Mishra, PGT physical education teacher. Today's session of topic is yoga as a preventive measure for the lifestyle. Under this, the overview of session is diabetes, procedure, benefits and contraindication. What do you mean by diabetes? Diabetes is where the insulin factor is increased in the blood, and for that cure some asanas are there, that is Bhujangasana, Shalabhasana, Supta Vajrasana, Mandukasana, Gomukhasana, Yog Mudra and Kapalbhati. We will discuss one by one. Now first asana is Bhujangasana. Bhujangasana is derived from Sanskrit word Bhujang means cobra, and since the final pose of this asana is resemble the holded as a snake pose, and that is also called as cobra pose asana, या cobra asana it is also called. Now what are the techniques are there? Take the prone lying positions, leg together, toes together, pointing outwards, hands by side of the body, fingers together, palms facing upward and forehead resting on the grounds. Fold hands on the at the elbow, place a palm on the grounds near each side of the shoulders, thumb should be under the armpits. Now bring the chins forward and place it on the grounds, on the gaze in front. Raise a chin, turn head back as much as possible. Raise the thorax, turning on the spine, backward up to the navel, and do not raise your navel. Maintain this posture for some time, then slowly bring your bodies back on the grounds, starting from the upper part of navel and thorax, shoulders, chin, and lastly place on the forehead on the ground. Now relax your hands and place them on either the side of your thighs. Now what are the benefits of Bhujangasana? Strengthen and increase the flexibility of spine and vertebral column. Open the chest, shoulder, heart and rib cage. Tone and strengthen the entire spinal extension group of the back muscles. Stimulate the endocrine systems and digestive organs. And it is good for kyphosis deformities. Now what are the contradictions? If any women's are pregnancy should be avoided. Avoid asana if you have spondylitis, and people are suffering from spinal injuries or weak their backbone muscle should be avoid this asanas. Next is Shalabhasana. Shalabhasana comes from Sanskrit word Shalab means grasshoppers and lotus. What are the techniques? Takes the prone positions, lying, leg together, toes backwards, soles towards the sky, hands by the side, palms upward, fingers together, forehead touching the ground, folding both hands at the elbow, bring them under the shoulder like a Bhujangasana, finger together and pointing up forwards. Now slowly bring both the legs upward without bending them the knees and maintain the position. Then bring the legs down slowly and come back to their original position and bring the hands back to their place. Now what are the benefits from Shalabhasana? It helps to reduce the abdominal fats and tones up the abdomen muscles. It is strengthening the back and neck muscles. It also helps to repairing the spinal cord and reestablishment, and it also helps to be rectify their neck pains and repair the defects of their neck joints. It also helps to rectifying their urinary disorders. It also strengthening the ureters and reproductive systems. It is also strengthening the hip bones and reduce any type of thighs muscles, excessive thighs muscles. It also helps to decrease the constipations. Now, what are the contradictions? किसको नहीं करना चाहिए? If you have acute back pain, or if you have the spin disc, should be avoided. If you have any type of sciatica, should be avoided. If you have major problems with their menstruations, you should be avoided. If you have the ureters problems, to avoid this asana. It is also especially that pregnancy women should be avoided. If you have high level of blood pressures problem, should be avoided this type of asanas. Now next is Supta Vajrasana. Supta means reclines and Vajra means thunderbolts. It is also the Supta asana. It is called as thunderbolt asanas. Now sit in a Vajrasana position. Slowly place your elbows on the ground near your hips. Slowly strengthen your hands and completely lie on your back. Now shoulders should be rest on the floor and knees should be remain together. After practicing the position well, making the shape on the both hands bring them under the shoulders. Right hand should be under the left shoulder and left hand should be under the right shoulders, and the head should be on the middle. When the returning the original position, first take out the hands and place them by the side of the body. Now with the help of elbows, sit in the first position. What are the benefits of Supta Vajrasana? It also it massages from abdominal organs, improving their digestive alignments and constipations, relieve their constipation. It tone up their spinal cords, back muscle flexibilities, relinings of their round shoulders injuries. If deformities, if it is beneficial from suffering from any type of asthma, bronchitis, and their lungs alignments. It has also increased the circulation in the brain. It regulates the functions of adrenal glands. It tone ups their pelvic muscles. It also helps to improving the disorders by the both males and female reproductive systems. किसको नहीं करना चाहिए contradictions? If you have the high blood pressure or spinal disc, should be avoided. If you have vertigo, this type of action should be avoided. And if you have the pregnancy woman or menstruation disorders, or if have the knee injuries, surgery, if knee injuries हुई है या might be the surgery हुई है, should be avoided to doing that Suptasanas. Now next is Mandukasana. Mandukasana comes from Sanskrit word Manduk means frog pose. It is also known as frog pose asanas. What are the techniques? Sit in a Vajrasana, make the fist with the both hands and thumbs inside. Place your fist on your belly next to the belly buttons. Now bends forwards with their exhalations and keep looking at the straight. Hold your breath, yoga postures in few seconds and come up their inhalations and repeat this asanas 3 to 4 times. Now what are the benefits from the Mandukasanas? Now Mandukasanas should help all the organs of your bodies. Mandukasana also relieve their diabetes, digestive system, digestive disorders especially, and constipations. It also improves their flexibility, mobility of knees and ankles. It also helps the muscles, shoulders and abdomen. Regulations their regular practice of this asana increase their lung capacities, and also this asana is reduce the thighs and belly and also the hip muscles. What are the contradictions? If you have the back pains, must be avoided. If you have undergo the abdominal surgery, should be avoided. If any pregnant women, this asana should be avoided. If anyone suffering from ankle, high blood pressure and insomnia, should be avoided. If you have any migraine type of pains, should be avoided. Now next is Gomukhasana. Gomukhasana means derived from Sanskrit word. Gom means cow and Mukh means face, यानी mouth बोल सकते हैं, mouth. Now what are the techniques? Sweep the arms behind the back, walking your hands up between your shoulder and blades, palms facing outwards. Stretch the left arm up. Now fingertips pointing towards their shellings. The palms, your hands still facing your forward, and bend the elbow and reach down the right fingertips. Now hooking the fingers, holding that fingers together if they reaches. Now what are the benefits? Now Gomukhasana, it develops the greater flexibility of hip joints. It stretch and tone up their muscles of the chest. It also helps to increase the blood supply to the lungs and arms, improve their functioning, abdominal and organ and digestive systems. It is especially the stretching their abdomens and unnecessary tummy areas का जो tone ups their entire torso. And what are the contradictions? Now contradiction, if you have suffering from any type of shoulder pains, backache, या hip, or it may be the knee pain, should be avoided, and should be avoided if you have pregnant women. Now next is Yog Mudra. Now the Yog Mudra, sit in Padmasana. What are the techniques of the Yog Mudra? Sit in the Padmasana, close your eyes, hold one wrist behind the back with the other hands. Inhale deeply. While exhaling, bend the forwards, keep the spine straight. Bring the forehead to the floor. Stay in the final position for as long as possible and comfortable, and slowly return their starting positions. Now what are the benefits of the Yog Mudra? It helps to stretch in the postures, muscles of their trunk and their neck, improve their muscles, toning up and the circulation of their spinal column. Now, what are the contradictions? If the pregnant women should be avoided, people have undergo the heart surgery, abdominal or brain surgery should be avoided, and care if you are taken from any peptic ulcer or hernia should be avoided from this asana. Now, next is Kapalbhati. Kapalbhati, the techniques of Kapalbhati, they involve their force and the fast in diaphragm breathing. In the comfortable sitting positions, one exhale the forcefully in contracting the abdomen and inhale. And inhale and exhale the accompanied with the abdomen movements with the take place in the quick successors of for a number of the times depending on their capacities. According to their capacities, you can do. What are the benefits? The greater it is greater for respiratory systems, helps to be respiratory system while they are passagings of including their sinus. It is improve their respiratory functions and promote their circulation, improve their balance. It also removes their acidic and gastric problem if you have. It also cures their sinusitis, asthma and hair loss. What are the contradictions? किसको नहीं करना चाहिए? If you have pregnant women, should be avoided. If you have the spinal disc patient, should be avoided. Now, if you have asthmatic patient, should be avoided. If you have the menstruation problems, if you have menstruation problem, should be avoided. Now, what are the references which I have taken? It is purely in curriculum 24-25, and the references which we are taking in CBSE CBSE manuals. It is present in CBSE academics handbooks which I was taken. Thank you.